billion people on the planet suffer from obstructive sleep apnea. Over 80% of obstructive sleep apnea has to do with a compromised airway. And that compromised airway is what's going on in your mouth, often the tongue. The tongue in your mouth may be tied. Your arch of your mouth may be narrow because you had teeth pulled for orthodontic purposes, or you lost teeth, or you had braces and Invisalign, and they kept moving the teeth and making the arch smaller. A very good friend of mine who wrote a book, 6 Foot Tiger, 3 Foot Cage. For many people who have sleep apnea, the 6 Foot Tiger is your tongue, the 3 Foot Cage is your mouth. So correction of obstructive sleep apnea, and we use the Vivos method, the Vivos system, is an appliance therapy that stimulates stem cells, remodeling the bone, expanding the airway for you to be able to breathe. But let's talk about the dangers of sleep apnea and why this is a source of chronic inflammation, toxicity, and death. 25% of middle-aged men, 75% of severe cases are undiagnosed. So 1 in 15 adults have severe OSA, 1 in 5 have mild. And it's linked to a lot of things. Everything from, car accidents to hypertension, heart attack, stroke, memory loss, diabetes, depression. If you're not breathing at night, you're depressed. Bedwetting in children. If you have to get up and go to the bathroom multiple times a night, you may have obstructive sleep apnea, and I'll explain why. But bedwetting in children, attention deficit disorder in children, depression, not to mention insomnia, and early death. And there is dementia and memory loss there. So traditionally, medical doctors would send you for a sleep study, and then they'd go, oh, you have obstructive sleep apnea. We got to shove air down your throat, and we're going to put on this gas mask called a CPAP machine, which, by the way, can be life-saving if you have severe sleep apnea. So when we treat obstructive sleep apnea with an expansion of the airway to correct the problem and not just treat the symptom, sometimes we have patients have to wear this while we're doing the treatment because they're at such risk of a heart attack or a stroke. So you see the tongue in the middle here. So what this does is this forces air to open back here in the back of your throat. Because the teeth are strangling the tongue could be tied. So the attachment of your tongue to the lower jaws by a ligament called the lingual frenulum. Many, many people. So we routinely examine you for this. And we do something called a home sleep study as well. But yeah, this is a CPAP machine. It is, it is forced air. And what happens when you use this for a long period of time, it stretches the tissue here. So it's almost like blowing a balloon up too much. Now, if you don't have the CPAP on one night, your sleep apnea is even worse. So the correction is something called a DNA appliance. And what does it do? It takes this narrow arch with a high vaulted palate, and we're able to expand the arch. And here's before and after of a cone beam of the airway. Here is before. This person is breathing through a coffee straw. And here's after. Look at the breath from just expanding the space for your tongue so you can breathe. And what's the appliance that does it? This is a removable appliance. It's not a rapid palatal expansor like kids get that have a narrow palate, but this creates steady arch development. It activates stem cells for bone growth and does not cause inflammation. We fabricate these. They crank and expand in the middle. You wear them a couple nights a week. And it's remarkable how the body adapts because those stem cells make new bone. We make new bone. Many times orthodontists move teeth around and patients lose the buccal plate of bone. They're trying to move the teeth in unnatural positions without expanding the foundation, which is the jawbone. So this creates bone growth. It's a remarkable device. So 80% of individuals who have sleep apnea are unaware, and the apnea can be present in children, babies, and excessive bedwetting and ADHD is related to sleep apnea, often misdiagnosed. So what do we do in our office? We do an initial consultation and screening. We do this virtually. We have patients, they can either get this CBCT at a center or in our office, and then we do a complete assessment. We use a home sleep study, and we do a sleep assessment. And we have a device we can send to you called a, I just forgot the name of the device. It is called, it's a disposable home sleep system. And I'm sorry, the name escapes me. I'll get it in a moment. And WatchPat, it's called the WatchPat, WATCHPAT, WatchPat device. All right, we're going to talk a little bit about TMJ, a really, really painful disorder. By the way, often people with sleep apnea, because of the arch being narrow, they often suffer from TMJ. And this appliance actually expands and helps to correct and eliminate TMJ disorders, temporomandibular joint dysfunction and pain.